Everyday effects of cancer. Don't worry, this isn't a long video filled with complicated words that you have to look up when you get home. Let's just go over how cancer might affect your everyday lifestyle. The first thing you should know is that cancer affects everyone differently, so you may never experience half the things we are going to talk about. But if you do experience any of these side effects, make sure to tell your nurse or doctor. They will be able to help you manage any symptoms you may have. Also know that side effects have nothing to do with how well the chemo is fighting your cancer. Now let's get started. You may have new side effects such as fevers or hot flashes, headaches, nausea, shortness of breath, cramping, constipation or diarrhea, stiff or painful joints, back pain, and tingling or numbness. These side effects may make it hard to breathe and move around. You might feel tired, worn out, or weak, otherwise known as being fatigued. Being fatigued can cause sleep changes and dizziness. Being fatigued can affect your everyday lifestyle because it can affect your mood and emotions, social relationships, and ability to cope. It might also make it harder to perform daily activities, your job activities, and your hobbies. Now it is time to discuss some changes your body might go through. You might experience rashes, sores, swelling, peeling and blisters, and dry and itchy skin. You might bruise easier and be more sensitive to light. You may lose hair, weight, and muscle, but you may also gain weight. You could have a harder time hearing and experience urinary changes such as urgency and frequency. Your nails may also change, but be sure to stop pushing back your cuticles because that could cause an infection. It may be harder to pick things up or button your clothes. You are also going to want to stay away from tight pants or shorts and perfume lotions. It is going to be helpful for you to wear clothes made out of cotton or other soft fabrics and footwear with rubber soles such as tennis shoes or sneakers. Also, be sure to exercise if it is okay with your doctor. You are able to have personal physical relationships during your treatment. If you desire to participate in a physical relationship, you will need to practice safe sex for 48 to 72 hours after a chemotherapy treatment. Physical relationships during cancer treatment are acceptable as long as you do not get pregnant. Ask your doctor about your sexual function. Your dental hygiene and eating patterns may differ as well. You may have mouth or throat changes such as difficulty chewing or swallowing, dry mouth, and mouth sores. If this is the case, you will switch to a soft toothbrush and remove mouthwash from your daily routine. You may also experience taste changes such as food tasting bland or having a metallic or chemical taste in your mouth. You could also be more sensitive to hot and cold foods. Make sure that you are drinking plenty of fluids and eating a balanced diet. This means cutting back on fat, sugar, alcohol, and salt. You could also eat 5 to 6 small meals a day instead of 3 big meals and stay away from buffets to avoid unsafe bacteria. This is no doubt a difficult time for you. You may experience new feelings that you have not had before. Things like depression, stress, anxiety, confusion, irritability, and a decreased desire for sex. It may be harder to remember things and concentrate. You may also have chemo brain. Chemo brain is when you have a foggy mind, trouble with names, dates, common words, paying attention, keeping daily tasks in order, multitasking, completing things on time, and learning. One resource that Lake Health University Hospital Seidman Cancer Center offers is our retail pharmacy. Our pharmacy is able to provide you with your treatment medications, anti-nausea medications, as well as your other supportive drugs your doctor prescribes. Unlike other pharmacies, we will help you save money on your medication and are able to fill your prescription while you are here for your appointment. Talk to your doctor about using this service. Please know you are not alone. We have many resources to help you with any symptoms you are having. Communication is key to being as comfortable as possible. Don't be afraid to ask for help and accept it. Call us if you are experiencing a fever of over 100.4 degrees Fahrenheit, constipation with no bowel movement for 3 days and have tried stool softener, diarrhea more than 4 times a day for 2 days and have tried Imodium, vomiting more than 4 times a day for 2 days and have tried anti-nausea medicine, if you cannot keep liquid down for more than 24 hours, mouth sores if you are unable to eat for more than 2 days and bleeding from anywhere, and before getting admitted to the hospital. You should go to the ER if you are experiencing chest pain, high blood pressure, stroke symptoms, falls, and things unrelated to chemotherapy or your cancer diagnosis. Check for signs of infections listed in your chemo book. Just call us. You are our first priority.